Good afternoon. My name is Bridget Foray. I am pleased to present COVID-19, a public health campaign to combat misinformation. What are COVID-19 vaccines? COVID-19 vaccines were developed in response to the global pandemic caused by the SARS-2 virus. These vaccines represent one of the most significant public health tools in modern history. The two primary types used in the United States are mRNA vaccines, such as those from Pfizer and Moderna, and viral vector vaccines, such as Johnson & Johnson's Janssen vaccine. mRNA vaccines work by instructing the body's cells to produce a spike protein, triggering an immune response. Viral vector vaccines use a modified virus to deliver genetic material into the body to achieve a similar immune effect. According to data from the CDC, these vaccines have been highly effective at preventing severe illness, hospitalizations, and death. They are a cornerstone of the national public health strategy and have allowed communities to reopen safely and return to normalcy with reduced risk. The first COVID-19 vaccines received emergency use authorization in December of 2020. This marked an historical moment in medicine, as the development occurred at unprecedented speeds due to global collaboration and investment. As of 2024, over 676 million vaccine doses have been administered in the US, and the death rate has been decreased by more than 85%. However, disparities in vaccine access and uptake emerged based on socioeconomic status, race, and political affiliation. This slide highlights the dramatic public health impact of vaccines in reducing morbidity and mortality, while also reminding us of the importance of equitable distribution and outreach efforts. COVID-19 vaccines have become a point of major public contention. On one side, public health experts, medical professionals, and many citizens advocate for vaccines as essential tools in preventing disease spread and protecting our communities. On the other side, some individuals express concerns about vaccine safety, potential side effects, or view mandates as infringement upon their personal freedom. In many cases, these views are fueled by misinformation or a deep rooted mistrust in the government and pharmaceutical companies. Understanding these differing perspectives is essential to designing effective public health messaging that addresses fears while promoting scientific facts. The COVID-19 vaccination campaign raises important ethical and political questions. These include debates over vaccine mandates, especially for healthcare workers and students, and the balance between individual liberty and community protection. Historically, marginalized communities may be more hesitant due to past ethical practices, like the Tuskegee syphilis study. Transparency and respect are crucial when engaging with these populations. Additionally, there were political disagreements between federal and state authorities regarding lockdowns, vaccine distribution, and messaging, while impacted public trust and vaccine compliance. Public health efforts must navigate issues of privacy and informed consent, especially when dealing with a novel virus and rapidly developing vaccines. HIPAA protects individuals' medical data, but during the pandemic, debates emerged over whether vaccine status could be disclosed in schools or workplaces. Similarly, the idea of vaccine passports raised ethical concerns about surveillance and discrimination. Disparities in access to vaccines were evident throughout the pandemic. Rural residents, low income families, and certain racial and ethnic groups faced barriers, including transportation, clinic availability, and internet access for online appointments. Language differences and historical distrust further complicated outreach. Programs that use community health workers, faith based leaders, or door to door campaigns saw more success in reaching hesitant populations. Cultural sensitivity isn't just a courtesy, it's a strategy for effective and ethical health communications. Social media has amplified misinformation about COVID-19 vaccine. Claims that vaccines contain microchips, cause infertility, or even alter our DNA have spread widely, despite being debunked. A major example is the controversy involving Robert F. Kennedy Jr., who has been criticized for promoting vaccine skepticism. In 2025, a reporter revealed that an FDA official resigned after resisting RFK Jr.'s push for unrestricted access to vaccine safety data, fearing the data would be misused. Combating misinformation requires swift, transparent, and accurate communication from only trusted sources. Public health strategies can be categorized as downstream, midstream, or upstream. Downstream strategies focus on individuals, like sending mobile vaccine clinics or offering walk in appointments. Midstream strategies involve community institutions, like schools and employers offering education or hosting clinics. Upstream strategies target systematic issues such as expanding healthcare access, improving sick leave policies, or funding public health infrastructure. A coordinated approach at all levels is needed to address vaccine hesitancy and promote informed decision making. Many organizations are actively working to address vaccine hesitancy. The CDC, We Can Do This. This campaign uses multimedia and partnership to promote vaccination. The World Health Organization also combats myths with multilingual infographics and educational videos. Local governments and nonprofits have created their own campaigns, often more tailored to their communities. These initiatives aim to build trust, increase access, and counter misinformation. To improve existing efforts, campaigns must become more community centered. Instead of relying solely on government officials, health departments can partner with trusted messengers like barbers, pastors, or teachers. Materials should be translated into multiple languages and distributed in non digital formats for those who limit internet access. TikTok, Instagram, and other youth targeted platforms should also be used to reach younger populations. Improving cultural relevance and accessibility is essential for future campaigns to succeed. Thank you for your attention. Below are the references used in this presentation, should you wish to explore this topic further.